Hey everyone. A friend of mine and colleague asked me an interesting question today based on an experience they had with one of their patients. Their patient was told by a fertility specialist that they had a diagnosis of endometriosis simply based on answering a few questions. More or less, they had a confirmatory diagnosis of endometriosis based on a clinical history. Now, this is really inappropriate, in my opinion. A clinical history can allow us to validate patient symptoms as real and worthy of investigations and worthy of treatment, but you cannot be certain about endometriosis simply by asking people a few questions. Unless, of course, those questions are, have you had surgery before, which diagnosed endometriosis, or an imaging test, which saw a nodule. Patients warrant investigations, and with the advent of imaging, there's no reason why a patient should be simply told, based on a clinical history, that they have endometriosis. They warrant imaging to evaluate the presence or absence of that disease, but in the context of it being seen, which organs is it affecting and what stage of disease is it? Are we talking about superficial endometriosis or deep endometriosis? Are there endometriomas? Are the fallopian tubes filled with fluid, in which case you have a hydro or hematosalpinges? The imaging is key to getting nuanced details to get patients on the right track for treatment. And moreover, the overlapping symptoms of adenomyosis with endometriosis are huge. So is this patient a patient with endo, or could they have adenomyosis, or could they have both? There's no reason to stop with a clinical history. Imaging is key for nuanced diagnostic evaluation for patients who have symptoms of endometriosis or adenomyosis or both.